Hello everyone, I am Dr. Gajendra R, Consultant Gastroenterologist at Bangalore. Today we'll be discussing on fatty liver disease, one of the most common and interesting topics in the recent times. First, let us understand what is fatty liver disease or non-alcoholic fatty liver disease. Initially, let us understand what is fatty liver. Fatty liver is excess accumulation of fat in the liver cells, making it harder to function. The most common cause of fatty liver is alcohol intake. When the cause of fatty liver is not related to significant alcohol intake, we call it as non-alcoholic fatty liver disease. Normally, liver contains some amount of fat. When the fat content in the liver exceeds 5% of the liver weight, it is called as fatty liver or non-alcoholic fatty liver disease. There are two types of fatty liver disease or NAFLD, non-alcoholic fatty liver disease, which includes simple fatty liver and non-alcoholic steatohepatitis. Simple fatty liver, where there is fat accumulation in the liver without any damage or swelling to the liver cells. Usually this simple fatty liver will not progress to cirrhosis. Another thing is non-alcoholic steatohepatitis. This is the most severe form of fatty liver, wherein there will be damage to the liver cells and swelling of the liver cells. This swelling or damage to liver cells can progress to fibrosis and cirrhosis. Usually it takes many years for the damage to cause cirrhosis in patients with NAFLD. Next thing is, how common is NAFLD? In the United States, it is the most common cause of chronic liver disease, which accounts to 25% of the population. Whereas in India, it is as high as 30% of the general population. Next, what are the symptoms of NAFLD or non-alcoholic fatty liver disease? Usually the patients with fatty liver or non-alcoholic fatty liver disease are asymptomatic. However, when the patients present to us with the symptoms, they usually present with fatigue or vague right upper quadrant pain. Once the signs of liver disease develops, patients usually progress to a stage of cirrhosis. When the patient has cirrhosis, such patients will present to us with jaundice, swelling of the abdomen or water accumulation in the abdomen, and blood vomiting or black color stools, and altered sensorium or encephalopathy. And this cirrhosis itself can progress to hepatocellular carcinoma over the long run. Okay. Next is, what are the risk factors, or who are the people who are at risk of development of non-alcoholic fatty liver disease? People who are at risk of developing fatty liver disease are people who are obese, overweight, or who have uncontrolled diabetes mellitus. And one more major entity is metabolic syndrome, which includes obesity, increased triglycerides level, hypertension, and impaired sugars. Such patients with metabolic syndrome are also more prone to develop cardiovascular disease or cerebrovascular diseases. How do you diagnose non-alcoholic fatty liver disease or fatty liver? Patients usually present to us with asymptomatic elevation of SGOT, SGPT on liver function test and routine blood investigation, or they usually come to us with a ultrasound report of fatty liver, which was done for other reasons. These are the most common presentations patient present to us. However, we have to do other tests for the risk factors or cholesterol levels, hepatitis B, hepatitis C, to rule out other causes of liver disease. And other imaging modalities like CT, ultrasound will tell us about the fatty liver and other related diseases. Next thing is liver biopsy. However, other blood tests usually makes us to the blood test and imaging usually makes us to the diagnosis of fatty liver. Liver biopsy is required to confirm the diagnosis of non-alcoholic fatty liver disease. Liver biopsy usually undertaken when other causes of fatty liver are difficult to be ruled out. And liver biopsy tells us about the diagnosis of non-alcoholic steatohepatitis, non-alcoholic fatty liver disease, and it also tells us about the stage of fibrosis and whether the patient has developed cirrhosis or not. This liver biopsy is a procedure wherein small part of the liver is taken and sent it to the laboratory for microscopic examination. And one more important test in the recent times is the fibroscan. This is the fibroscan is a special test which uses ultrasound scan to estimate the stiffness of the liver. By estimation of the stiffness of the liver, we can assess the fibrosis and the cirrhosis stage of the liver. This fibroscan is a non-invasive alternative to liver biopsy. How do we manage these patients with non-alcoholic fatty liver disease? One of the most important thing in the management of fatty liver disease is maintaining a regular healthy weight reduction. That is, weight loss of 10% of the body weight is most important for the fatty liver disease. Next thing is maintaining a balanced diet, that is avoiding refined sugar, high calorie sugars, or saturated fatty acids. And pill therapy is usually reserved for severe stages of fibrosis or non-alcoholic steatohepatitis. Vitamin E is the most common drug which is used. However, in the recent times, there is saroglitazar and obeticholic acid, which reduces the fibrosis on liver biopsy specimens. These are the drugs. When the patient has developed cirrhosis because of NASH, liver transplantation is usually offered to such patients. Now, take home message are tips to maintain the healthy liver. Maintain a healthy weight by regular exercise with a balanced diet, avoiding high calorie diet, saturated fats and refined sugars, and regular physical activity, and avoiding toxins, that is avoiding ethanol intake. And last point which I want to tell is recent advance is the fibroscan. All patients with fatty liver and NAFLD should undergo fibroscan to assess the stage of fibrosis and start treatment to prevent the further progression to the cirrhosis and its complications. Thank you.